Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHIL, the Civic Health Innovation Labs.
CHIL is an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHIL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as what are their day-to-day tasks, how did they get into the role that they currently have, and what advice would they give if you are interested in getting into this area of work yourself.
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City Region.
Hi everyone, and welcome to our first episode of Health Data Decoded with me, Ed Hill.
And me, Samuel Ball.
So thank you very much for joining us. And so in this episode, it's going to be kind of a conversation between myself and Sam as to who are we and what do we do, and Health Data Decoded, what does that mean? So perhaps we'll start just with, so what are our current roles and kind of what does that broadly involve day to day?
Yeah, so I'll start. So my name's Sam Ball. I'm a lecturer as part of CHIL. So my main role is to upskill and train NHS analysts so that they can better understand data themselves. So we do a lot of programming, we do a lot of statistics, machine learning and artificial intelligence, just so that we can kind of try and extract some insights from patient data and make everything run a little bit more smoothly. Because we've got a lot of data, but we don't really know what to do with it yet.
So, and that's already showing that's such a broad range of applications and skill sets, which is, as we will learn, health data is very wide encompassing. There's a lot.
That
happens within it.
It's massive, yeah, and actually it's been massive for quite a long time. So my previous role in research was biomedical imaging. So this kind of recent trend of large language models is really just the tip of the iceberg of where we can go with AI.
It's a rapidly changing area, so watch this space.
So what about you?
So I'm also essentially a lecturer, so began just this current a few months ago in Liverpool. And so I work in infectious disease modelling is my main research area. My role also involves doing some teaching and then supervision of projects. So working with master's students, PhD students, generally with the application on problems in epidemiology, so things related to health, using model frameworks to analyse, say, spread of diseases and use that to assess what might be good in terms of intervention options. Can we help improve our understanding of the disease system? And also think about communicating these findings and how do we make this useful for those who might use this in terms of, say, policy making. And so quite interested in behavioural dynamics that combine with the infectious disease processes, so epidemiological, social processes, and animal and human health, what's happening at the boundaries there, things like avian flu, bird flu, etc. So lots of big problems that require bringing people in from different areas. So this interdisciplinary work, range of expertise, because then those contributions mean we can make more progress than each of us working in our individual research areas.
Yeah, so CHIL in general is very interdisciplinary, isn't it? So we work with a lot of different people. I think one of the great things about it is that we're always talking to clinicians and medical staff to kind of make sure that what we're developing as data people follows the medicine and make sure that it's clinically sound.
Absolutely. So Sam, one of the projects you're linked to is something called a Data Action Accelerator. Is there anything you would like to elaborate on in terms of what that as a project broadly is?
Yeah, so the Data Action Accelerator really has two parts. It's got the training part and the kind of health impact part. So I'm kind of leading the training part. And the big idea of that is basically we've got an awful lot of people in the NHS who want to learn more about how to use the data that they get. So we've got a lot of clinical staff, we've got a lot of management staff, and we all know that we've got loads of data to work with. We've got Excel spreadsheets with loads of different kind of patient data, kind of non-patient data. But we don't really have the skills at the moment to understand what's actually going on in that data. And there's this massive bridge between, or this massive gap that needs to be bridged between people who work on data and then actually the research that goes on how to use that data. So my job is essentially to make sure that the people working with the data have the skills to efficiently understand it, analyze it, get insights from it, build models to kind of be able to predict what's going on, so that we're taking the stuff from academia, the kind of blue sky thinking research, and bring it to actually have impact for health in the NHS.
That's it. So essentially it's like a translation type step in some way. It's
definitely
unlocking this knowledge.
And one of the big
users.
things, so one of the big things is that we know that we're trying to get more AI into the NHS, but one of the big dangers that we have is that it's all being done by AI experts who have no clinical expertise. So the big idea behind the DAA really is that if we can get the people who are experts of their kind of data to be able to have the skills to analyze it, then we don't run into this problem of just having these kind of AI people who live on the computer making clinical health decisions. It needs to be driven by the clinical people.
Absolutely. And then another broad aspect that the Civic Health Innovation Labs, CHIL, is involved in is, and with all this data, it's thinking about kind of accessibility, security, and ethical use of data and how that's ever changing in now the world of machine learning and AI. And so there's various projects where like this is a very active consideration as well.
Yeah. I mean, it's really is ever evolving, and we're always trying to come up with new ways of getting the training out there as well. But I'm interested to hear about how you got into epidemiology.
So this is going back to when I initially entered university as undergraduate. So I'm an applied mathematician from that background. So through my mathematics degree, I went to do the applied courses as the years progressed. And so initially that was perhaps more broadly some mathematical biology type modules. So that included perhaps some initial population type processes, more like within host cellular type processes. But then the kind of infectious diseases population level type modeling, there was some particular modules on that I found very interesting. And so then I carried that on to then master's and PhD study, so my postgraduate, where I then became focused on the infectious disease modeling components. And then, carried on from there to then my initial research roles, which then working on specific projects, looking at questions to do with cost effectiveness of vaccination, or thinking about bird flu and what's called spillover transmission, so transmission from the, say, livestock hosts, so particularly poultry to humans. And so I've just always then been kind of fascinated by the problems within that area. How about yourself in terms of moving from the initial university study to where you are now?
So it was really interesting, actually. So I actually started in mathematics as well. And one of the crazy things about AI is actually how mathematical it is. And when I started, a lot of people said that if you wanted to get into AI, you actually are better off with a mathematical background than a computer science background, which has been a bit bizarre over the years as it's kind of evolved and moved, and there's been more maths and computer science as time's gone on. But I did my undergraduate, I think, as you did it in mathematics. I did it in University of Liverpool, and I did a master's in mathematics as well. And then for my PhD, I decided that there was I didn't want to stay within maths, and the applied maths at the time that we had on offer for the PhDs here were kind of more of the kind of mathsy modelling stuff. And at the time, I had an interest in coding, I had an interest in technology, and I knew I wanted to go into AI, so I started looking at where could I start to use the maths and AI skills that I'd learned within my maths degree in other departments. So I joined the biology department in the University of Liverpool, and I did a really enjoyable PhD on drug discovery using statistical modelling and AI. and it was in a lab that had absolutely no tech people or math people there. It was all biologists. So there was always kind of this thing of kind of bringing those skills to a new group of people. And that was also a very interesting learning experience. And I think that's where it started to become more of you need to learn the domain skills, so the biology skills, to be able to understand the data problem. Probably the most frustrating part of the PhD was going in and recording my own data with growing my own cells and stuff, because I'd never gone into a lab before. But it was so valuable to understand the actual nature of the problem that we were trying to solve. And then after that, I moved into biomedical imaging. So I was looking at OCT and colour fundus imaging, so images of the back of the eye. I did that for a while. I did a really cool project involved with trying to diagnose malaria for kids in Malawi. So that was a really important project. And then I got the role here. So we're now looking more broad scope, more kind of big idea, big picture, using AI to try and affect health outcomes. But yeah, it's kind of, the journey kind of comes from theory all the way up to practice, which has been really valuable, I think.
Thanks for sharing that, because you can see as it's progressed how that, again, the interdisciplinary type nature has come in as you've moved through the various projects. And just talking about the imaging of the eye, etc. So it's made me realise, actually, at the optician, sometimes they will take the photo, or sometimes so it gets the image of the eye. So does that mean if you're at the optician, it's like, and they show you the photo of eyes, I actually know in great detail. These images I've been shown.
That's probably my favourite part of the project was during the project I actually had my routine eye test, and I actually asked the optician if they could send me all the information, because it's the stuff that I use in all the slides that I use for teaching now. As I say, this is kind of my eye, and here's the AI that we're going to do to it, and we should talk about, like, why should we use AI in these cases? One particularly interesting part of it is you can use eye imaging to detect stuff like cardiovascular and neurological diseases. But one of the big questions that I was working on was, how can we apply AI to it in a way that is clinically relevant? So, and it's kind of linked to how we're applying data within CHIL, is that what we were doing as an AI department at the time was we were kind of coming up with this yes or no definition of does this eye image exhibit signs of cardiovascular disease or something. But when you talk to clinicians, it wasn't actually that helpful to have that as an output. They kind of wanted to know why. So this big problem that we were trying to solve within the group was, how can we give a little bit more richer information for clinicians so that they can make informed decisions, instead of just having this algorithm say, yeah, they've got a cardiovascular disease, or yeah, they've got a neurological disease, because you need that clinical mindset as well and have it on balance.
That's it. And so it's like you kind of bring research into the teaching side as well, which I think is very important in terms of what we're presenting to, say, the students and their training. So that's something which we're actively keen to keep on pursuing as well. So I have an anecdote with the interdisciplinary perspective. So my first ever research projects during my master's and PhD program, so that was at the University of Warwick. And so that was looking actually at social contagion. So it was looking at using this spreading like models, but being applied to not an infectious disease, but more a behavior or a mood state specifically here that could be then linked to perhaps health related issues. But my supervisors for that, so there was a mathematician, but then there was also someone from the medical school. As this was my first research project, I didn't necessarily appreciate at the time the fact I was getting input here from, say, a more clinical side as well as the theoretical side. But when I look back, it's like, oh, actually, that was like super useful, because I can then, if it was just purely a theoretical project, we would not have had to steer in terms of perhaps the relevance of what the model was telling us. How does this relate to the actual clinical literature? Does this make sense? Is it plausible? But that, I think, because I had that initial experience then, that's then moved forward in the projects I've done since, where it's typically there has been, well, a wish to get the perspective from the virologist, the medical sciences, the biologists, as well as on the theory side as a collective team.
Yeah. I mean, it's super interesting. So I remember, I mean, we've had a talk about that social contagion work. But I just want to ask you a question on it because I think it was really, really interesting because normally I think when people talk about epidemiology, they think about infectious diseases like bird flu and COVID. But can you just tell me a little bit more about how you used epidemiology and about that social contagion stuff?
So the premise of that work was, I guess, was there support for that potentially your mood state, so whether it being high or low, basically being able to spread from one person to another in friendship groups. So there was a data set from the USA with teenagers back from the mid-1990s. And so by using some mathematical models for how your mood score might change from one time point to another, dependent on the friends you have and their mood states, would a spreading-like process, contagion, better explain the real-world data? Or was there essentially no relationship? If you just had random changes, would that equally as well describe the data? So it's taking what the spreading model you could use for an infectious disease, but it's then applying it to this other mechanism where to ask the question, does it spread like a disease or does it not? Is there support for that?
Yeah.
So we can apply perhaps these techniques to other questions within health, and that could be public health, veterinary health, plant health. That doesn't necessarily immediately seem like it's would be a relevant tool to use.
Yeah.
So that's
it's interesting how it's been
use of tools
applied
across different areas.
Yeah. Because that's one of we've got as part of CHIL, we've got the EMRIC project, so we're trying to improve kind of mental health outcomes based on big data and better understand mental health, kind of populational health. So it is important to be using kind of AI for these things. I'm just wondering, as part of that research, when you have this kind of network spreading analysis of depression and mental health problems, do you know how you think that could be used in order to kind of improve the lives of kind of teenagers in this case?
And that's the important point of, can this analysis then help inform interventions in terms of if it's the case that actually healthy mood there perhaps is support for, that seemingly to spread, is making efforts to kind of bolster that within friendship networks to focus on the plus points rather than perhaps trying to focus on perhaps the downsides. So whether it's a messaging related to the types of messaging, if there's different age groups or risk groups that are targeted, or the type of messaging that they receive, that might have an impact. These are potentially through the outputs from modelling exercises and other data sources, it might be able to help inform these type of interventions.
Yeah. So I'm interested from a getting involved standpoint. So I know obviously you're very involved in the research and kind of outputting papers, but how can other people get involved with health data research for epidemiology?
So there is one project I'm currently on where there is an active, say, public involvement group, or patient and public involvement group, and that's trying to be at the forefront of actually where can these public involvement groups usefully contribute as part of the active research process of this infectious disease modelling. So these patient public involvement groups, typically it's a small group of people, so some might be patients if it's on a particular condition, so they might have experienced the condition themselves or have a known person known to them that's experienced a condition, or they might just be general public members, but they're there to offer a sounding board and different perspective on the research being done, so they can ask questions about basically, well, why are you asking this question? Is it relevant? What type of data are you using? Are you using the most relevant data sources, or why are you not using perhaps this data source, which you could? Is there a reason you haven't? You can sense check your results, so you can present your findings to them, and then they can ask questions about it, and that means gives you another way to process what are you presenting. Does this make sense? Is it logical? And then it's this longer term process of enabling everyone to basically be an active contributor to this work, and therefore we want to instill perhaps the general knowledge about what this involves, and therefore enhance, say, the trust and the purpose of the modelling as well, and what it can and also what it can't do, which is equally as important.
Yeah, it's so important, isn't it? I think we're constantly at danger of, particularly within health research, of if we're doing too much kind of blue sky research and we're not keeping in touch with the people that it impacts, we kind of run the risk of making people feel that they're not in control and they don't have a say in the kind of research that's going on. I think next week I'm talking at a forum and we're having a big discussion about AI in health. So it'll be really interesting to hear what people feel we could be doing better, where people want kind of the efforts into AI, where people feel like we're not investigating where we should be. Because at the end of the day, it's what research is about, isn't it? We're trying to solve problems that matter to everyone, not just kind of print out papers which we're interested in. And I think in general, people want to help out. I mean, people get into health and people get into being a doctor because they want to help other people out. So yeah, it'll be really good if we can kind of get people involved in that.
No, fully agree.
Yeah.
So with that, just say thanks, Sam, for sharing your experiences and your viewpoints, and thank you all for listening to us and our first episode.
Yeah, thanks, Ed, for sharing, and we hope by doing this episode you'll understand a little bit more about what we do. You can follow us on social media on Blue Sky or other social media platforms. We hope that you can feed back to us on Spotify or wherever you're listening to this from.
Yeah, and you're welcome to also leave us a review as well, or what might you like to hear about in future episodes. And with that, thank you again for listening or watching, and we hope you will join us again next time.
Goodbye.